Hello, my name is Maya Rolfe. I'm a second-year medical student here at Chicago Medical School. So I'll be performing an interview with you today, and you can feel free to answer questions how you would desire. My first question, well, not my first question, but could you take a few minutes and just sort of introduce yourself and let us know who you are?
Okay, my name is Monique Jones.
Okay. All right, great. So why did you decide to come to Chicago Medical School?
I decided to come to Chicago Medical School. It was a natural extension from where I was at IIT.
Okay.
I was part of the Chicago Area Health and Medical Careers Program there at IIT.
Okay.
And it was just a natural progression to come to CMS because we already had family or other students that were here.
Okay, great. And so why did you decide to pursue medicine?
I had always dreamed of being a doctor. I remember even being in kindergarten and telling my teacher that that was my desire, that I wanted to be a doctor. So I never dreamed of doing anything else.
Okay, great, great. Tell me about your experience in the PMP program.
My experience in the PMP program was definitely just like learning and getting to know a new family member. The students that I started with, they're still friends today, still call each other and give each other consults over the phone. It was just a community, and the support that was at CMS was remarkable.
That's how I feel also. What is your specialty and why did you select it?
My specialty is obstetrics and gynecology. I've always loved women's health and helping other women overcome any obstacles in their lives.
Okay.
So it was just a natural transition for me. I enjoy the birth of new life. It's such an awesome experience. I've been doing it and I'm not tired. Every birth is different. Most of my patients are happy and healthy, and I can help stay part of that continuity of care from their first pap smear into menopause. I'm just part of their life, and I enjoy that continuity in OBGYN.
Okay, and I'm going to break this question into twofold. So it's what piece of advice would you give to current students? Could you give advice to students that are pursuing to try to get into medical school, and also give advice to students that are currently in medical school?
I think my advice would probably be the same for both.
Okay.
And that is to be persistent and to follow your dream.
Okay.
There's nothing like being able to live that dream. If that is your desire to get into medical school, if the first place you apply to doesn't accept you, then that's not the place for you. It doesn't mean that you can't have your dream. It just means that's not the right place for you. You have to apply somewhere else or look somewhere else. The same thing for students. Once you're in, you've been accepted, so you definitely have the capability of making it. There are going to be obstacles. It's just an obstacle. You look at an obstacle and you find a way around it. Because your dream's too important to let it die.
Yeah. Okay, and this is the last question. What is the most important contribution you feel you've made to the medical field and society?
I think I still have to work on it. I feel like I've made some good contributions. As far as where I am currently in the south suburbs, I was one of the first gynecologists to do Da Vinci and robotic surgery. Starting that back in 2009, so I think I've made a lot of inroads as far as that goes. I came back to Lake County when I first finished medical school and worked at Lake County Health Department. I think I touched lives there, but then I needed to go on and do some things for my family. So I think I still have some work to do. I think that's why I'm still here.
Great things, though.
I've got some more to do.
Well, thanks so much for taking the time to encourage us and inspire us to continue on our path. And we definitely appreciate, as students, the path that you've already paved and allowing us to realize that we can make a difference in our community and the lives of others. So,
and I think that's something you keep doing. You know, that's why I say I haven't reached my greatest point yet. I think that's something you keep doing throughout your entire life. And I think that's a real important, even as a student, that you realize.
Okay. All right. Thank you so much. Hi, my name is Maya Rolfe, and I'm here to interview you about your experience at Chicago Medical School. So could you first start off by introducing yourself and letting everyone know a little bit about you?
Hi, Maya.
Hi.
Nice to meet you.
Nice to meet you, too.
I'm Dr. Dennis Garrett. I'm a general practitioner. Also, now recently started a MPH program. Actually, I'm just about done. Last semester of doing a Master's in Public Health.
Okay, great.
At Chicago State University. I attended Chicago Med in the late 90s, and I finished up in 2000.
Okay. Okay. So I have a few questions here that I'm going to ask, and you feel free to answer them in any way that you choose. So my first question to you is, why did you decide to pursue medicine?
Yes, attended a school named after a famous physician, Dr. T.K. Lawless.
Okay.
And they went to the library and wanted to know about him. And I read about him in this book called Great Negroes, Past and Present. And this physician was a dermatologist, skin specialist. And I was inspired by his story. He treated people from all over the world. The Lions to see him right in the hood on Martin Luther King Avenue, Chicago, stretched for blocks and blocks, several blocks long. Again, people all over the world came to see this person, a black man. And he treated everybody, whether they had the money or not. If they didn't have any money, he treated them. And so I said, yeah, I want to do that. I like that. Okay. So that was my first inkling of wanting to pursue medicine, to do what he did. And he was also a philanthropist, so he gave a lot to a lot of different causes. But T.K. Lawless was my inspiration on wanting to go into medicine.
So it sounds like it was more of a mentor, that you had someone to look up to that pushed that desire to become a physician.
Yes. I think, yes. I think it was just looking at him as a mentor and say, wow, I can do that. He did this, okay. And yes.
Great. Okay. My next question is, why did you decide to come to Chicago Medical School?
Chicago Medical School support system. Came up and interviewed with the dean at the time, Dean Booten, and liked what I saw was a support system here. I think for the success of minority students, particularly African American students, as having a support system. Definitely saw this support system here. Support system in terms of the study groups, how expected students to do well, and work with each other to ensure each other's success. And I always felt that in terms of the schools I attended in the past, that led to my success. In undergrad, it was a study system similar, so I felt I would be best served by going to Chicago Medical School, where they had concept of group study, individual study and group study to help in one's success.
Okay, great. So tell me about your experience in the PMP program.
The PMP program wasn't called PMP back then. It was just the pre-matriculation program, component of a CHAMP, Chicago Area Health and Medical Careers Program. I alluded to just a few minutes ago, that we're expected to, study in groups. It's essentially what we did. We would eat, sleep, and study medicine. That was my experience. We would eat, sleep, and study medicine. While we were having breakfast, we were studying. While we were having lunch, we were studying. We would sleep in the study halls. We were always studying biochem and physio. So it was around the clock studying. There was other activities, the SMA Student National Medical Association. We would participate in those events too. Mm-hmm. But it was around the clock studying.
And what is your specialty? You gave a little bit about that before, but why did you select it?
Oh, no. While I was influenced by T.K. Lawless, I changed from looking at going into dermatology early on. I'm a general practitioner, and I chose to be a general practitioner because general practitioners, I feel, have a greater impact on the lives of the patients in terms of prevention. I think most of the illnesses that we encounter, at least 75% of them, would be high blood pressure, obesity, hypertension, obesity, diabetes, is due to things that are preventable. Mm-hmm. And I think as a general practitioner, I can reach those patients in terms of as a general practitioner rather than as a specialist. I think they're not very important, mm-hmm. but I think if we attack issues, particularly in the African American community, focus is upstream. We can thwart a lot of these issues in terms of what is a great what we call disparity there in terms of health. High rates of diabetes, high rates of strokes, all kinds of heart disease. So if we attack it upstream in terms of prevention, education, I think we can thwart that, those challenges.
Great, great. So what piece of advice would you give to current students?
I think depending on the specialty you choose, you can obviously focus on in third and fourth years on electives that's going to be relevant for you later. However, for me, I think that in my fourth year that I took a lot of electives in internal medicine. Not that I was going to necessarily go into internal medicine, but because in specializing or subspecializing, which was still a possibility at the time, can get you away from those basic part of medicine that whatever the patient is suffering from goes back to things that we see in relevant to internal medicine. So I'm kind of biased, obviously, as a GP, general practitioner, but I think the endocrinology is important, pulmonology is important, infectious disease is important. So I would say make sure if you're looking at subspecializing, make sure that you get a grounding in those areas, because that'll help in whatever area you ultimately decide to specialize. In terms of the going further back, in terms of the basic sciences, the physio, pathophysiology, all those classes are important. They all have obviously relevance, but ethics, all those courses that you're going to be exposed to, that you're going to have, are important. I would say a nutrition course, to focus on the nutrition. Anything more holistic or global in medicine, I think, is important, that focuses on prevention. Obviously, I'm biased as a GP, but I think prevention is key.
Great, great. And you were going to give advice to students that may not be in medical school. What advice would you give to students that are pursuing or currently trying to gain admission into medical school?
I think that if they're looking at gaining admissions in medical school, is to work from a position where they know that they will obviously shine. So if their major was English or journalism, they should talk about the relevance of journalism in terms of medicine, and that how one can practice and still be a physician and do those things in terms of journalism. So, I would say that I don't think that they have to look at medicine, matriculating into medicine in one, coming from one particular field, being pre-med, pre-med chemistry, pre-med biology, that medicine is diverse, and they should look at what area that they're coming from and background as a strength and as a contribution that they will make into medicine. That's how I look at it for myself in terms of the contributions I think I'm making in medicine.
Great, that's nice. I like that. So this is one of the last questions. What is the most important contribution you feel you have made to the medical field in society?
Prevention. Currently working with Dr. Yehuda Green, also graduate of Chicago Medical School, on telemedicine for the masses, looking at telemedicine not only in a traditional way in terms of training nurses and doctors, but having access for the masses in terms of they getting training in terms of telemedicine. working alongside organizations, community organizations, and training them in terms of other areas of healthcare field that might not be, that's not necessarily what we call the MOPVOP, medicine, osteopathic, podiatry, public health, but other health career fields. So I practice medicine with Dr. Green in the manner that we not only do primary care, but we do the other kind of ancillary parts of medicine we think is important. Ancillary in terms of the social parts of medicine. We embrace the World Health Organization's definition of health, which is not just treating, just not the absence of disease, but we look at health as a social component, that you be socially healthy, not just physically healthy, mentally healthy, psychologically healthy. So given that we know that in terms of prevention, in terms of health, we must engage the community, individuals and families, not just in terms of and just in the office, but outside the office to make sure other things are in place so they can be holistically healthy.
Great, great. Well, that's the end of the questions. If there's anything else, comments that you would like to make, feel free. But I just want to thank you for your time. This has been great. Even I have, sitting here listening to you, have learned a lot.
Oh,
just
great.
From
Good,
the interview.
good.
So thanks so much.
You're welcome, and great success to you.
Thank you so much.
You're welcome.
Bye-bye. Hi, my name is Maya Rolfe. I'm a second-year medical student, and today I'll be interviewing you and just asking you a few questions.
Okay.
Feel free to answer them in any way that you choose.
Awesome.
And could you please just introduce yourself and tell us a little bit about yourself, please?
Hi, my name is Ronald Rembert Jr. I'm a family physician in the Chicago area. I graduated from Chicago Medical School in 2000.
Okay, great. So my first question is, why did you decide to pursue medicine?
Medicine was always a dream for me. Even as a child, I dreamt of being a physician, even when it wasn't popular or looked at as being glamorous. Always wanted to help people, but even more than that, I saw it as being a calling where you would get a chance to not only touch people's lives, but even in some cases save their lives. And it's been a dream fulfilled, really has.
Okay, great. So my next question is, why did you decide to come to Chicago Medical School?
Well, Chicago Medical School has been so receptive to not only myself, but to students who may have gone to other places and not done well, or in my case, I never was given an opportunity. I was accepted in other medical schools, but Chicago Medical School not only provided the best fit, but they made me feel at home. I was able to grow here and to flourish. It's a wonderful place. It's a wonderful institution.
Okay, great. Tell me about your experience in the PMP program.
I came into the PMP program. Dr. Bradley told me about it when I was at University of Illinois during my undergrad years. And he was like, yeah, we have this program up at Chicago Med you need to check out. And I was like, I don't know. I came up here with them, and I was like, oh, wow, I got to definitely get enrolled in this. So I ended up, I think, taking biochemistry. And during that time, I was a teacher in the public schools for a little bit. I taught, I think, for 2 years in the public schools. But while I was doing the teaching, I was actually in the PMP program. And it worked out well. Teaching taught me a lot in being able to, stand in front of people and lead a group of people, especially kids. But the PMP program was a family, support network even to this day, where many of us are still in contact with each other. We can call each other for referrals or call each other with different questions about different specialties.
Great, great. So what is your specialty and why did you select it?
I'm a family physician, and I like seeing everybody. I like seeing kids, I like seeing adults, I like seeing patients throughout the entire life cycle. So family medicine was a perfect fit for me.
Okay. And what piece of advice would you give to current students? And we can break this into a twofold. You can, because some students that may watch this, they may be actually trying to get into medical school. And then you can also speak to current medical students that are in medical school now.
Okay. My advice is not only work hard, but you're going to have to be able to do more than one thing. And I'm saying that in terms of understanding how medicine is changing in this country, understanding how technology is changing in this country. By the time many of you graduate, you'll have to be fluent in using electronic health records. You may be doing telemedicine where you're examining or evaluating a patient who isn't even in the same room with you. You may, and most people will, have a smartphone that has various apps that you can utilize to better keep track of not only your patients, but to pull up patient records on your phone and to be able to round on patients without even having to log into a computer. I mean, the technology and the advances are just staggering. You can have radiologists who never have to set foot in a hospital because they're having the film sent to them to their iPad, and they're reading it and giving the results over the phone. So as the advances in technology continue, as the advances or changes in medicine continue, you have to be able to change with those changes and just keep working hard.
Great. What is the most important contribution you feel you have made to the medical field and society?
Mentoring and teaching, training other students who will become physicians, and I'm currently mentoring several students.
Okay.
But seeing those people who you've mentored now as physicians, now who are in their communities or helping others. When you mentor or teach someone, you're replicating yourself and you're extending that reach. So they may be able to go someplace and do something that you're not able to do. But in effect, you're still able to touch someone's life that way.
I really like when you say replicating yourself. I've never thought of it like that. And it just, I see myself as a replication of previous mentors and people that have helped me. And then it gives me another way of looking at it in the future, that the students maybe just one word or one visit that could possibly replicate. And that's just so important because it's something that we study every day here. So it just, you can really see it not only just within science, but just even within society, how it really is the same mechanism of the same thing.
Yes, it
So that's
is.
really cool. And my last question is, why did you decide to pursue medicine?
Medicine is a field where no matter how much you learn, there's still room to grow, to learn, to know. I love learning. I love, just continuing to grow as a person. But medicine allows you that opportunity that even when you think you know something, there's still another facet that you can learn. There's still something else that you can add to that. And being in medicine, you apply what you've learned and the knowledge that you've gained to help better people's lives. So it's a win-win situation for me.
Great.
Yeah.
Well, that concludes the interview session, and I thank you for your time and
Awesome.
wish you all the best as you
Thank you,
continue
Maya.
to really encourage and inspire students to walk within that same path that you've actually already paved for us. So thank you so much.
Thank you.